Welcome to You and Your Pets. I'm Jim Horton, and we're here with our resident expert, Dr. Ernest Rogers of the Maplewood Animal Hospital. And we deal with a lot of pet issues and owner and pet issues on this show. This is our beginning of our fourth season. And tonight we're going to be discussing an important subject of preventative health for pets. And what exactly is preventative health for pets, Dr. Rogers?
Well, welcome back, Mr. Horton. I'm glad we're back for another season. And to start off the season, we're going to talk about preventative health, but I would like to digress as the programs go on to actually speak about specific diseases and their significance. But preventative health is really the object that we veterinarians and physicians talk about in terms of preventing the need to treat disease as best we can. Clearly, preventative health is monitoring the patient for any signs, early signs of disease or problems that we could correct simply, either by diet or by a simple change in lifestyle. So preventative health is the simple monitoring of the animal's physiology and medical parameters to ensure that we can early detect any problems that might arise.
So where does it, in the panoply of healthcare for pets, where does this fit in the overall regime?
Well, realistically, we like to think that we're going to use preventative health to keep the patient as healthy as we possibly can for as long as we possibly can. As you know, health is just the slowest way to die. So there really is no end point that we can look at and say that we're going to prevent health and this animal's going to live to be 42 years old if it's a dog or 43 years old if it's a cat. It just doesn't work. But it's the quality of life, and preventative health fits into the overall plan by ensuring good quality of life for as long as we can. And then when we have a disease or we have a physiological abnormality, then we can treat that early enough so that the animal still has a good quality of life. Clearly, we're all going to pass on at some point, but we try and ensure that the quality of life is good for as long as we can possibly make it.
So what aspects of preventative health should the pet owner be aware of?
Well, I think there are lots of different areas, but preventative health really is making sure that the veterinarian, whoever your veterinarian is, sees the animal at least once a year, and in some cases twice a year. But there are also procedures, medical procedures that we use to ensure that an animal is going to continue to have health, and whatever the situation is for that animal and its lifestyle and where it lives, we try and ensure that any diseases or any problems that may be exposed to, we monitor for those specifically. So here in the Northeast, we might monitor for such things as Lyme disease, whereas in the Southwest or in the Northwest, they might monitor for something called salmon poisoning. So basically what we look at is we look at what in our environment or what that the animal might be exposed to would be a significant issue. And we go from there, and then we monitor for those things. Or we try and protect the animal. One of the ways in which we protect animals is by using vaccines.
And vaccinations are, I know, a regular part of your healthcare program at Maplewood Animal Hospital. What vaccinations should be, and what are the differences between the vaccinations for dogs and for cats?
Well, we have the American Veterinary Medical Association, of which I sat on the committee that wrote the strategy for vaccines. The American Medical Association, American Veterinary Medical Association, has put out a list of what we call core vaccines. These are vaccines that all animals in our environment should have, irrelevant to anything else. If they're a dog and they're in the Northeast, they should always have rabies. They should always have distemper. And if they have any contact with any animals outside of their immediate family, then they should probably also have Bordetella. That's for dogs. Now, there's a slight difference between dogs, whether it's an adult female, adult male, or puppies. Puppies get their first vaccines somewhere between 6 to 8 weeks. And what we do is we give them one vaccine at 6 to 8 weeks. 3 weeks later, we booster that vaccine so we maximize the protection that this animal has. Now, let me back up and say that a vaccine is not like an aspirin. You don't give a vaccine like you would take an aspirin and it starts working immediately. The way a vaccine works is you put the vaccine under the skin and then the body recognizes it, and the body makes protective factors. So giving the vaccine alone is not the only part of what we do when we give a vaccine. The body actually has to recognize the vaccine, and the body has to make its own protective factors. So we start a puppy at 6 to 8 weeks. We booster it at someplace between 9 to 12 weeks, and then we give the final ones after 12 weeks. So rabies, we only have to give one vaccine, and that's after 12 weeks by law. But distemper and bordetella, we usually give 2, booster it twice before the animal gets to 12 weeks. And that also gives the animal sufficient protection at 12 to 14 weeks to ensure that if it's exposed to some of these diseases, it's less likely to get them.
Now, those are the major diseases. What determines the total number and types of vaccines that a pet should get? For example, if it's an outdoor pet more than it's an indoor pet, does that make a difference in the kinds of vaccines that you would prescribe for that animal?
Certainly it does. But let's just for a second back up and talk about vaccines in cats. Because again, we have core vaccines. Kittens get their vaccines again at 6 to 8 weeks, 9 to 12 weeks, and then again, a final one after 12 weeks, which would be the rabies. Cats and dogs both have lifestyles that expose them to certain things. So cats may well get a vaccine which is called distemper, but it's actually a combination vaccine of multiple disease factors that against which the animal would develop protection. One of those is rhinotracheitis, leptospirosis. We have other things that we have in the vaccines. So the core vaccines for cats are rabies and distemper. Now, similarly for dogs, the core vaccines, as I said, are rabies, distemper, and in some cases bordetella. Other vaccines can be given. There are many other vaccines. An outdoor cat would probably also want to get feline leukemia, because outdoor cats that run in a herd, so to speak, or they get exposed to other animals, feral animals, who may have feline leukemia. You want to protect them. You want to give them a certain measure of protection so that those animals whose lifestyle includes going outside and being outside should probably have feline leukemia. Similarly in dogs that are hunters and are running through the bush or running through the reservation and are exposed to ticks should probably have a Lyme vaccine. Lyme vaccine helps protect them against the disease, Lyme disease. But I think we have to really let everyone know that vaccines help protect. They are not a be-all and end-all. Because your animal has a vaccine or because you get a flu vaccine is not 100% guarantee that you're not going to get anything else. It just lessens the risk for whatever you're vaccinating against. And so outside cats, outside dogs will have a certain set of different vaccines based on their lifestyle.
Okay. Are there side effects with vaccines, and are any of them things that we should be concerned about?
I think we talk about a lot in veterinary medicine about vaccines are pretty innocuous, and I think the average veterinarian out there may well think that veterinary vaccines are pretty innocuous. We do know that some vaccines made for cats have secondary effects, and in some cases may even cause cancer. We aren't sure which ones, we aren't sure how you give them, we aren't sure which animals. Not every animal will get cancer, but some vaccines do have side effects. And I'm glad you asked that question because it takes me back to my days of doing research as a PhD student, where I looked at vaccines. And there are many, many subtle issues that go along with giving a vaccine. Respiratory vaccines might cause changes in the lungs that make them initially more susceptible to a disease. So vaccines are not innocuous tools that we give, and you can give 10 vaccines and you don't have to worry about. Some animals will have an allergic reaction to a vaccine. So all these things have to be taken into consideration. Lifestyle, risk factors, benefit factors, allergic issues, and then the animal itself. What is the animal going to be exposed to?
How does an owner know when his pet is having an allergic reaction to a vaccine? Isn't that rather difficult to tell?
It can be difficult. I've been in this business since I was 7 years old, so it's been a long time. And quite frankly, I've only seen two or three real vaccines. Even when I was working in an emergency clinic, would you expect to see them? In a dog, we often get something called edema, or facial swelling. So the dog looks like as if it's been blown up with a balloon. It looks like a balloon dog. The whole face and sometimes the body will swell up. Some animals might get hives, but it's that specific to dogs. In cats, we find that if a cat's going to have a reaction, and I've only really seen one of these, it's often in the lungs, and they will sometimes foam, they will have difficulty breathing. So usually what I recommend is, if you have any reason to suspect that your animal may have a reaction, if you don't know and you're not sure, then sit in the waiting room for 20 minutes after we give the vaccine. If it hasn't happened within 20 minutes, that's not a guarantee it won't happen, but it seems likely that if a veterinarian is there and looks at your dog after 20 minutes and there's no even subtle signs, it's unlikely that there's going to be signs later on.
Are there any homeowners out there or pet owners out there who believe that vaccines can actually injure their animal, much like they do with humans, and not vaccinating their children?
I'm sure there are. For a while, as you know, it was thought that autism was something that occurred because of the measles vaccine, and there was a researcher in England who professed that, and it ended up being not true, and he was disgraced, and I believe he's now living someplace in the United States, but he's no longer doing that research because he was disgraced. He drew conclusions based on facts that he didn't really have. Similarly, in veterinary medicine, we do know that some vaccines will cause cancer. Some vaccine will cause allergies. But it's very difficult to pinpoint the vaccine and pinpoint the animal. It's a combination of the animal's immune system and the vaccine itself.
Okay. We have several other issues that we want to talk about, one being parasite control. Can you just get us started on that, and then we have to take a break pretty quickly?
Sure. We all know about parasites. We talk about external parasites and internal parasites. External parasites are often ticks, fleas, and lice. Internal parasites in the intestinal system are often worms, and we talk about that. And then the other type of internal parasites that we see in both dogs and cats, surprisingly, are heartworms, and they're in the blood vascular system. So that's basically, when we talk about parasites, those are the three areas that we talk about: external, internal intestinal, and internal blood.
Okay, we'll take those up right after the break. I'm Jim Horton. This is You and Your Pets with our resident expert, Dr. Ernest Rogers, and we'll be right back.
Television is a powerful and influential medium that allows different groups the opportunity to produce programming that directly affects their own communities. Public, educational, and government access channels ensure that all people, regardless of race, age, gender, disability, religion, or economic status, have access to local government information and the use of a public communication forum. Make sure everyone has a voice. Support your local PEG channels.
We're back with You and Your Pets and Dr. Ernest Rogers of the Maplewood Animal Hospital, who's our resident expert. And as we said just before the break, we're going to deal again with preventative health and parasites. And you dealt briefly with the parasites that are of concern to dogs and cats. Could you go into them one more time in greater detail?
Certainly. I'd like to make it clear to our audience that when we talk about intestinal parasites, external parasites, and heartworm, which is an internal vascular parasite, we talk about these things, we're also talking about issues that relate to public health and people's health. So let's start off with fleas. Fleas and ticks, obviously a difficult situation in a house. Not only will fleas make you itchy and ticks will spread disease, fleas can also spread disease. There's also issues with lice. There are certain lice that dogs and cats can come in contact with, particularly if they're strays or if you have strays in your environment or if the animal comes from a dirty environment. All these things are things that the animal can pick up in its environment and bring into the house. That becomes a public health issue. but I think most of us know about fleas, the small blood-sucking insects, ticks that are small blood-sucking insects, and some lice that are small blood-sucking insects. So anytime you have an animal that's going to access blood, whether it be in a dog or in a person, there's always a possibility of infection and disease transmission. So it's also a public health issue that we treat our animals. We first identify the problems that might relate to fleas. In other words, you look at your dogs, you look at your house, you look at your environment to see if there are fleas. And then you always use a flea or tick deterrent on your animal. Some are better than others. I like to think, I'm not going to mention any names, but I like to think some of the more popular ones are not as good as we currently think they are. So always check with your veterinarian as to which ones you should be using, again, for the risk that your animal poses. If your animal doesn't go into the bush and is never exposed to ticks, you don't need a tick preventative. If your animal goes into the bush and hunts, or even goes into the bush and is likely to pick up ticks and fleas, then I think we have to look at a more robust flea and tick preventative.
What about an animal like our dog? He'll get out on the lawn and something piques his interest, and he'll turn over on his back and he'll just rub himself around, and he moans and groans while he's doing it. He's having a great time. But is that kind of behavior something that lends to more fleas and ticks, or is that a pretty safe behavior for the animal?
Well, I think no matter what, even if your dog is a small dog, never goes outside, your cat never goes outside, when we walk across grass, the feral cats that exist, the feral dogs that exist, the raccoons, skunks, possums, will all carry fleas. And these fleas will jump off the possums or whatever animal happens to be walking across your lawn and may lay eggs. You will pick those eggs up on the bottom of your feet, sometimes in the cuff of your pants, and track them into the house. So one of the best ways to prevent that is to leave your shoes outside the house, or use a good coconut. I call them a coconut mat. They're brown and they're really rough, and wipe the bottoms of your shoes. But no matter what your dog is, there is no safe behavior. Getting back to your point, your dog is going to likely pick up fleas someplace. Whether you see them or you don't see them, whether you get away with them for one season or you don't, your dog is likely to pick up fleas.
Okay, let's turn now to a larger issue, which is the intestinal and also heartworm.
Right. Well, briefly, intestinal parasites really fall into the big ones that we talk about, which is whipworm, hookworm, and roundworm. Often we'll see people who see these in the feces, bring them in, and it is an issue, and we want to treat that. It's an issue, again, of public health. Little kids and children that don't wash their hands, that get poop on their hands for whatever reason, crawling around on the grass, crawling in the house, touching the dog, whatever the situation is, if they get that poop in their mouth, it's called the oral fecal route. And that's a horrible thing to think about, but that will initiate the eggs to mature and become regular worms. And in very young children with an undeveloped or a poorly developed immune system, that can cause blindness, it can cause heart disease, it can cause brain disease, it can cause liver disease. So we have to be very, very careful about intestinal parasites, particularly roundworms. So again, the solution there is see your veterinarian, bring in a poop sample every year when you go in, whether you think your dog has been exposed or not. I'd rather have 10 dogs come in that aren't exposed than one dog that comes in that's been exposed and is positive, and we don't see it. We don't get the poop. And then potentially the people in the house, adults usually just get diarrhea, but the young children can have some serious illness. So intestinal parasites are an important part of preventative health for the owner, as well as preventative health for the animal.
Well, that raises an issue. If that is such a danger, should somebody hold off getting a pet in the household until, say, the child is 5 or 6 and not crawling around on the ground like that?
Well, I think physicians would say you should never have a pet in the house because all these things are all possible. I think with good health, with good hygiene, and paying attention to these issues, I don't think it's a problem. I think it's something that we have to be aware of, just as we have to be aware of that if you don't buckle your child into the seat, you may have an accident, the child may get hurt. So it's at that level I think we have to pay attention, we have to take precautions. Once we've done that, the risk is minimized.
Okay. Let's turn now to heartworm.
Heartworm exists in both dogs, and surprisingly, people don't know it, in cats. And there have been a number of human exposures where people have actually had heartworms. The difference between dogs and cats, in cats, the heartworm parasite is spread by a mosquito. The mosquito bites the animal, it goes into the tissue, makes its way to the blood vessel, and then in the cat, it goes to the lungs. Sometimes we have cats that come in that are coughing and having respiratory problems, and we, of course, test for heartworm. But by far the majority of cats, even though they might be positive for heartworm, we have no issues that we see in them on physical exam. If we tested them, they might be positive, but there are no other issues. On the contrary, dogs, when they're exposed to heartworm, the heartworms go into the blood vessel, go to the heart, and block the artery going to the lungs. And when that happens, we have problems with the heart pumping, and the heart tends to back up and get bigger, and that causes heart disease in the dog. Mm-hmm. The unfortunate thing about heartworm in the dog is that the treatment is almost as bad as the disease itself. The treatment uses poisons, and those poisons sometimes cause the worms to break apart, and those worms that are broken apart can go to the lung, to the brain, to the kidney, and cause a stroke. So, and the poison itself has consequences in the animal. So, preventative health would say, get your animal tested. As long as it's negative, start it on heartworm preventative. Because heartworm preventative, for a dog such as yours, a 10-pound, 15-pound dog, would be something on the order of $60 a year. But if your dog came down with heartworm disease and I had to treat it, you're probably looking at $1,000. So preventative health, again, we're looking at preventing or mitigating a risk of heartworm by, number one, testing, so you have to see your veterinarian, and number two, giving the appropriate medication to stop the parasite from entering the blood system.
Okay. I'd like to turn now, if it's all right, to dental care. And my question there is, why do animals need it, and why do you put the animal under anesthesia in order to do a tooth cleaning? I think I know the answer to the second one, but I asked it anyway.
But I'm willing to have you come over and have a live animal, a completely awake animal, and I'll let you brush their teeth, and you'll see why. I mean, I'm being facetious here, of course. Dental cleanings are very important. Obviously, we brush our teeth twice a day, we floss twice a week, and we see our dentist twice a year. And even then, the dentist still says we need a cleaning. So our dogs don't brush most of the time. And our dogs don't floss. I don't know too many dogs that floss. And certainly, they don't see me twice a year for a cleaning. So we know that over time, the development of first tartar, and then it hardens and becomes calculus. As that happens, first it's plaque, then tartar, then calculus. As it happens, it gets under the gums, pushes the gums up, exposes the root of the teeth, and the teeth become loose and then fall out. So I'd much rather clean teeth in a dog that's 12 years old than wait until he's 15 and all his teeth are falling out. Now we have to pull them or do something else. That's one issue, tooth loss in dogs and cats. The second issue is anytime you have gingivitis, which is an irritation of the gum, which is caused by tartar and plaque and calculus, anytime you have that irritation, you also have bacteria getting into the bloodstream. You also have bacteria in the mouth. And so all these things are infections in the mouth, in the bloodstream. And this is some of the reason why your dog, when he goes to kiss you, go, whoa, or, your breath is really bad because they have an infection. So seeing your veterinarian once a year, have your veterinarian look in the mouth. And I actually smell the breath if the dog isn't going to take my face off or the cat isn't going to take my face off. And I can tell by the smell of the breath whether he just ate food or whether he actually has an infection. And in either of those cases, where I know that there's a lot of tartar or where I know that there's halitosis, bad breath, I like to go in there and clean out the teeth.
So is there something that should the owner be doing exactly what you're doing, smelling the dog's breath once in a while to try to determine if everything's okay? Or should they just make it a habit of bringing the animal in and leaving it up to you to do it?
I think preventative health requires a visit to a veterinarian. An astute owner can certainly look at the dog's teeth and say, yeah, this is a problem. Can smell the dog's breath and say, yeah, this is a problem. But the next step is to do something about it. Or if it's a minor problem, do something to help prevent it becoming a major problem. Mm-hmm. And that really requires the expertise of a medical professional, a veterinarian.
Okay. What other issues in preventative health should we be concerned about in dealing with pets? We have about 2 minutes left, so...
Okay. Well, I think we talked about using anesthesia in dentistry, and I just want to make the point that anesthesia today is much safer than it had been even 10 years ago, and that the worries that most people have about anesthesia during a dentistry are not well-founded. We still have problems, but not to the extent that we did 10 or 15 years ago.
Okay.
So the other issue is really what other preventative health issues should an owner be looking at to try and assess their animal? Well, sudden increase in obesity, sudden increase in weight, sudden decrease in weight. Ravenous eating is not necessarily a good sign, particularly in a cat. Not being able to chew, that's a bad sign in an animal. Excessive drinking, that usually makes us think of diabetes or kidney disease in both dogs and cats. Things like tumors that pop up and bleed, or even tumors that you haven't noticed that all of a sudden are there, are things that owners can find on their animals, should address and should take their pet to the veterinarian for an assessment. We can also assess the animal by using blood analysis, and that gives me an indication of what's going on inside the animal by monitoring chemicals from the kidneys and other organs. And that also gives me a heads up as to what we need to do to make the animal's life a better quality life.
Okay. We've run out of time, but I want to thank you very much. And if our viewers have any questions for Dr. Rogers, please get a hold of him at maplewoodAH@comcast.net. maplewoodAH@comcast.net. This is You and Your Pet. I'm Jim Horton. Thank you very much for watching.